call the meeting to order at this point. This is Terry Kearns, and I'll ask Crystal to do the roll call.
Okay, Gina Flores O'Toole.
Present.
Shayla Holmes.
Apply to only the license holders in the industry.
I'm gonna call first. Oh, Shayla was here and I don't see her. Oh, there she is. She's joining now. I'll go back. Christine Payson. Dr. Terry Kearns.
Present.
Assemblywoman Jill Tolles.
Present.
Dr. Stephanie Woodard. And Shayla Holmes. Oh, Shayla is connecting to audio, so I'm going to give that a minute and call for her again. Good morning, Shayla. We're taking roll, so I'm going to call your name, and if you can let us know that you're present. Shayla Holmes?
I'm present. I apologize for my technical difficulties this morning.
No problem. Good to have you here. Chair Kearns, we have 4 out of our 6 members, so we have a quorum.
Thank you. I appreciate that. We'll go on to the next agenda item, which is public comment. Public comment will be received via the Zoom meeting. Public comment shall be limited to 3 minutes per person. No action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241.020. So at this point, we'll open it up to public comment. Does anyone have any public comment? Do you see anyone, Crystal?
I don't see any hands raised on the virtual meeting. And if anyone has called in, feel free to unmute yourself and begin public comment.
While we give it a minute to see if anyone has public comment, I do see that Dr. Woodard has joined us. Okay, we will have a period at the end of the meeting for public comment again. So we'll go ahead and move on to the next agenda item, which is to review and approve the September 13th, 2022 meeting minutes. All the members should have received these prior to, so we'll give you just a minute to look through those and see if anyone has any thing they would like to amend on them. If there's no suggested amendments, would look for a motion to approve.
So moved.
Stephanie Woodard, I'll second.
Okay, so we have, I didn't catch who made the original
Sorry,
motion.
Assemblywoman.
Thank you, sorry. So the motion was brought by Assemblywoman Tolles and seconded by Dr. Woodard. So the meeting minutes from September 13th will be approved. At this point, we'll move on to the next agenda item, which is finalizing the subcommittee recommendations. And for much of the conversation, Crystal has collated all of the recommendations and suggestions we've gotten from the last SURG meeting and from some of the other subcommittees. So I'll tender the mic to Crystal to start the discussion.
Thank you. I just wanted to go back to our last agenda item. We had a motion and a second, and we just need a vote. I believe.
Thank you, sorry. All those in favor of approving the minutes from September 13th, 2022, please say aye or raise your hand.
Aye.
Aye.
Any opposed? Any abstentions? The meeting minutes are approved. Now we can move on to the recommendations. Thank you, Crystal.
Okay, so I wanted to, first, our recommendations actually start with this guiding principle to harmonize criminal justice and public health responses to promote access to treatment and medical care, to reduce criminalization and punitive practices towards individuals with substance use disorder. We did have some comments at the October 3rd meeting that some of this felt a little bit out of line with some of our other recommendations. That's what I'm just recalling from the minutes. So we can return to this since it's a guiding principle and see if our other recommendations still feel like they fit with it. But I would just open it up now for discussion on this guiding principle and any revisions anybody would like to make. Assemblywoman Toles.
Thank you. And I appreciated the comments and the discussion. And as I went back and read it, we could take a few different approaches, but the balance here is to hold into balance the harmonizing criminal justice and public health responses, particularly in regards to treatment and care. And I know that corporately, all three subcommittees, I really do believe are coming together to harmonize those goals, and that we want to be very cognizant of that in this subcommittee, but this subcommittee is a little bit more weighted towards including that other half of the balance, which is that harmonizing the criminal justice piece for holding traffickers of illicit and illegal substances accountable. In addition to holding into balance, promoting access to treatment and medical care to reduce criminalization and punitive practices towards individuals with substance use disorder. So I wondered if maybe to make it clear and hold equally that space for that balance, so that it doesn't look like the recommendations that are more in line with the criminal justice traffickers accountable piece isn't in line, to just add that to the end. So in other words, it would read harmonize criminal justice and public health responses to promote access to treatment and medical care to reduce criminalization and punitive practices toward individuals with substance use disorder while holding traffickers of illegal substances accountable.
Sorry, Assemblywoman Toles, you cut out at the end. So while holding
Traffickers of illegal substances accountable. And I'm certainly open to feedback, but I thought it was a fair comment that this harmonizing guiding principle spoke more in detail about the treatment side, which is absolutely a goal of this committee, but that there is also an appropriate place for holding traffickers accountable. And maybe we want to use a different word, but I wanted to submit that to this subcommittee to discuss, and very open to your feedback.
For the record, this is Terry Kearns. I like that suggestion because while prevention, treatment, and recovery are all important aspects of what we're looking at within this committee, also one of the overriding issues we need to look at is supply of illicit drugs. So I think adding that holding traffickers of illegal substances accountable is a good addition to that guiding principle.
Dr. Woodard has her hand raised. Go ahead.
So I'm tempted to do some wordsmithing here, and I don't know if necessarily this is the most appropriate time to do it without a little bit of further discussion. I think the challenge with having a guiding principle is that I think we're the only subcommittee that's put forth a guiding principle. And what I recall from the conversation also was a concern that sort of this guiding principle is sort of hanging out there and it's not necessarily applicable to all of the recommendations that the committee may be making. And so I'm putting that out there to say, you know, we've got one guiding principle and then other recommendations. And I think the goal here was to capture this information as sort of a frame or an intent to some of the recommendations that the subcommittee is putting forward. So I think in this case, context matters. And I think that while, you know, we can account for some of that context by adding language here, I think that also ensuring that somehow it is overtly and purposefully connected to the recommendations, specific recommendations that are coming out of the subcommittee, can also help to sort of amplify the intent of the guiding principle.
So Dr. Woodard, am I understanding that you're saying maybe we should not have the overarching guiding principle within before our recommendations?
No, so to clarify, what I'm saying is the guiding principle, I think, really is an overarching theme to a couple of the recommendations that we're putting forward. So we may or may not need to augment the language in here if we're very intentional about connecting it to the recommendations the subcommittee is making as sort of the more detailed information related to this guiding principle. My concern here is that the language, while holding traffickers of illegal substances accountable, that seems very specific. And I'm worried that we might actually lose some of the guiding principle kind of global nuance by getting that specific when we know that it's really related to specific recommendations that we have for the subcommittee.
Thank you for that clarification. I see Shayla Holmes has her hand up.
I just wanted to say I appreciate Dr. Woodard's comment. I was concerned with this guiding principle in regards to, I don't think it does capture the essence of all of the recommendations that we have on the table. And I agree that it came out of several specific recommendations, and I just had concerns with how limited it makes our subcommittee with some of those specific details.
So Shayla, are you, I'm hearing two things. We had a recommended addition. I think from Dr. Woodard, I heard that the addition maybe doesn't fit. And then Shayla, if I'm hearing you correctly, you think maybe we don't need the guiding principle?
I'm not sure if I'm in agreement with Dr. Woodard that if it's going to be an overarching guiding principle for the entire subcommittee, I think it needs some more wordsmithing. Because I don't think it captures the thoughts behind all of the recommendations that have been put forth. I don't know if perhaps if we wanted to go a guiding principle route, we have buckets of recommendations that we've seen, and if there's not a guiding principle for each of those, I don't know if that's additional work that's unnecessary since we are the only subcommittee with a guiding principle. Perhaps within the recommendations, this guiding principle could be ahead of the group of recommendations that it represents. I understand why we kept it because we all were in agreement that this is something we wanted to do, but I also don't see it being applicable to all recommendations that we have within our subcommittee.
Okay. I see Assemblywoman Toles has her hand up, and then I'd love to hear, Gina, your thoughts, and then it might help if we come back to this once we see all of our recommendations. Go ahead, Assemblywoman Toles.
Thank you so much, and I appreciate those comments. And and I do agree, it is kind of limiting the reason for, and maybe adding that language was, if I recall the conversation directly, it came up in two recommendations. One having to do with the overdose fatality review, and then the other one having to do with fentanyl. But I think that going through the recommendations and revisiting this later might be the best approach. One idea that I wanted to throw out there was we come into this a lot when we discuss legislation about when we start to enumerate specifics in statute, we get ourselves in trouble, because then we start, once you open up that can of worms, then you start, well, if we added this, then we need to add these 5 more. And then if we forgot something, then, it ends up being limiting. And I think maybe I inadvertently added that dilemma for our subcommittee too, because now it's like, well, if we're going to add this, then we should add something for every recommendation. And then before you know it, we have a thesis. And so I think that going back to the original discussion of what resonated for us was really the simplicity of harmonized criminal justice and public health responses. And then the recommendations and justification, I think for each recommendation speak for themselves. And that may be just the quickest, easiest way to simplify a guiding principle whilst not eliminating it altogether, and then not going the other direction of overly enumerating each one. Thank you.
Thank you. I'm trying to edit on the fly. So if I have that correctly, just as a possible to make it simple, I think that's what I heard. Gina, do you want to add anything here?
I don't want to be redundant. I agree with simplifying that first sentence. It seems like we're adding, to promote access to treatment and medical care, reduce criminalization and punitive practices. It's just kind of a toggle. So I would agree with simplifying it.
Okay, I see heads nodding. So we will come back to this. I think we probably need to take maybe not a formal vote, but we do need to have agreement on what we're putting forward for the next SURG subcommittee. So that's where we're aiming to get to at the end of today. I'm going to keep going through the recommendations. Your group has the benefit of the other subcommittees met earlier this month. So we have a lot of information on the slides, some of which there's one slide that we've added to since sending it out. But you'll see recommendations that were received from the October 3rd SURG committee meeting. Then you'll see some input from the other subcommittees, if they had any, or you'll see the direction that they are taking their recommendations that might be related to ours. So we have a lot to put together and to consider, but I think that helps so that you can understand, what will happen on December 14th in terms of how recommendations are connected or different. So with that, this is our first recommendation to support legislation to establish a statewide and regional overdose fatality review committees and recommend an allocation of funding to support the OFR to effectively identify system gaps and innovative community-specific overdose prevention and intervention strategies in accordance with established best practices. And we've included those from the Bureau of Justice Assistance. I think I'm going to go through all the slides related to this recommendation, and then we'll come back to any wordsmithing on the recommendation itself. If you recall, the Prevention Subcommittee has a similar recommendation or a related recommendation around supporting a backbone agency that specializes in data collection, evaluation, analysis, and assessment, and provides consultation to entities across Nevada to help improve internal local data collection systems and create a comprehensive statewide data sharing system that includes all state data dashboards and public data. So they have suggested an inclusion for our recommendation, which is after established best practice, including data sharing agreements between public safety and public health. They are planning to retain their recommendation related to the backbone agency, so that their recommendation for us to add the data sharing agreements is to facilitate, I believe, their recommendation around the backbone agency. I just wanted to make it clear that they were not foregoing that recommendation here. So I'm going to go through our justification and action step related to this, just so you can fully see what we're thinking when it comes to this recommendation. So we talked about current systems limit data sharing, and first responders and public health don't fully understand. And then by conducting a series of OFRs, jurisdictions can see patterns that can then build programming around, or whatever the response needs to be. We said that an action step was a bill draft request. I believe the conversation was that for this to happen at a state level, we need the legislation. For it to happen at local levels, the legislation, I think Dr. Woodard, you could help me out here. I might still be connected, but I can't. Can anybody hear me still?
Yes.
Okay. My Zoom just crashed, so you might not see my screen anymore. But I do believe that we needed that enabling legislation to allow for it at the state level, and just to make it clear that
Crystal, I can't hear you now. No,
Sorry.
there, now we can.
Okay, so the action step bill draft request, and we have a research link to the OFR toolkit that's also built into our recommendation. So that's the full picture. I'm going to go back up to the slide that has the text of the legislation, or sorry, the recommendation. And Dr. Woodard, I saw that your hand was up earlier.
So Stephanie Woodard, for the record, I just want to clarify, you said that the prevention subcommittee was anticipating retaining the full language in their recommendation. And so what they are recommending to this subcommittee is to add specificity to our recommendation on the overdose fatality review committees, to include information and data sharing between law enforcement and public health. Is that correct?
That's correct.
Okay. So Terry, I think you probably have the most information as it relates to best practices. Do you feel that the addition of that language is necessary? Is the information and data sharing between public health and law enforcement already an expressed best practice? Or do you feel that it should be in here as inclusive?
Yeah, I was going to comment on that. So thank you for the thought. My thought is that I believe that data sharing between public safety and public health is one of the best practices under the toolkit that Bureau of Justice Assistance Practitioners Guide has for implementation. So my question is, if we're adding just that one, why are we not adding the others? Or would that just fall into the best practices that are outlined within that, and within the recommendation and the practitioner's guide for implementation? So I don't necessarily see justification for calling out one of the best practices as opposed to calling them all out, or just lumping them under that general category of best practices.
Stephanie Woodard, for the record, I would agree. I think that, again, similar to the conversation we had around the guiding principles, when we start then listing what is included in best practices that are already stated in best practices, we run the risk of then having to put everything in there, because why would we put one of the best practices in greater specificity and detail and not all of them?
And I would also agree that, Terry Kearns for the record, that the prevention subcommittee supporting the backbone agency for the data collection should stay, because I see these two as separate, and perhaps some of the information from the overdose fatality reviews would support the dashboard or backbone agencies information that they're putting up on this. I assume it's going to be a dashboard or something like that. Do any of the other committee members have any thoughts?
I'll jump in. Assemblywoman Tolles. So I definitely agree with Dr. Woodard's statement about if we start and highlight one, then it just implies that we're excluding the others, and or people will just think I'm gonna stop right there because I know what the priority best practice is, and then I'm not gonna go read the actual document with the rest of the best practices, and we might miss some key tools in the toolkit. But that being said, when I read it, just for ease of delivery, one wordsmithing option that I had written ahead of time before the meeting was just to rearrange it a little bit so that it wasn't in parentheses. In other words, it would say support legislation to establish statewide and regional overdose fatality review committees and recommend an allocation of funding to support the OFR to effectively identify system gaps. And then I would actually put B, implement data sharing agreements between public safety and public health, and C, innovate community-specific overdose prevention and intervention strategies as in accordance with established best practices, such as the Bureau of Justice Assistance's Overdose Fatality Review, Practitioner's Guide to Implement. It still highlights the data sharing agreements, but separates it out from the distraction of, okay, now I don't have to go look at this best practices. And it would still draw anyone who would read the report to then go review all the best practices that they hopefully recognize, oh, one of them was already included in the list. That's an alternative of taking it out altogether. But I think that putting it in as parentheses runs the risk, as Dr. Woodard pointed out, that it will then cut us off from looking at all the other best practices. So I'll leave it. I'll leave it to the discussion of the committee. I could see both sides of including it or not, but I do think taking it out of parentheses is something that we could all agree on.
This is
So if
Terry
I was
Kirk.
trying to,
Oh,
I'm
go
sorry,
ahead,
Dr.
Crystal.
Hearn. No, go ahead.
Okay, I was just going to say my only thought in putting the data sharing between public safety and public health under the OFR is, in my mind, this should be a practice beyond just the OFR. So in response and in other things that we are doing and trying to set up the frameworks or models for, is that we should be having public safety, public health sharing agreements in other areas. You know, some for drug seizure information, if there's a big drug seizure, or if public health or our hospitals are seeing an increase of people coming in with overdose from a certain type of drug, that we should be able to share. And that goes beyond the ORF. So my fear in calling this out in the ORF is it almost seems like it limits it to this, whereas we would like to have it in other areas as well.
Sheila or Gina, can we just hear from you on your thoughts on this one?
I agree with the discussion and leaning towards taking that out because it's implied in the practitioner's guide. It's kind of how I'm reading.
I'm
Yeah, what
having
about you?
similar. Oh, I'm so sorry. Got a delay in the mute. I'm having similar thoughts in regards to. I agree with the discussion, but agree with leaving it broader.
Okay, so what I'm hearing for this recommendation is that we won't at this time make any changes.
Crystal, I might even go a step further. I know in the prevention subcommittee's recommendation, they talk about create a comprehensive statewide data sharing system. So it almost feels to me like the public safety, public health data sharing agreements should be there, because, you know, what I was saying before is we're looking at it more than the overdose fatality reviews. We're looking at it for response, you know, if we want to send out a message, because like a bad batch message, we would need it much more than just for the overdose fatality reviews. So I almost feel like that could be included in their comprehensive statewide data sharing system. Because we would have to have those agreements to share the data anyway.
Dr. Woodard?
Stephanie Woodard for the record. Crystal, I don't know if, can you share your screen still, or I'm not able to see the language. That would help.
Really, really sorry. I thought I was. I'm so sorry. When it crashed, I just thought everything resumed. Did you want, is this what you wanted to see? I was trying in the background to work on that revision that Assemblywoman Toles suggested, but I think we're kind of leaning towards keeping it as is. So I paused there, but if you need to see anything else, please let me know.
Thank you, Crystal. This is very helpful. Stephanie Woodard for the record again. Based on what Dr. Kearns's recommendation is in reviewing the prevention subcommittee language in their recommendation, I would agree that it seems that the language that they are suggesting would actually make a nice potential addition to the recommendation for the prevention subcommittee.
Okay. Well, we have noted that, so it will be in our committee's notes, and this will come up again in the December 14th meeting to just kind of describe how we arrived at the recommendations that we did and if we're making any additional recommendations. I can, as staff, I believe I can type this up and share it with my other staff members so that they can see, and then they can decide to share it with their committees as well. So that they have a heads up before December 14th that we're making recommendations back to them. So I just want to pause again on our justification and our action steps, and any additional research links you can send to me. Does this still feel accurate for the justification and action step needed to accomplish that recommendation?
This is Terry Kearns for the record. I think that it does, and I would defer for opinion from Assemblywoman Toles and Dr. Woodard for the bill draft request. If we're suggesting that, we would have to find someone who would support that and take it forward. Is that correct?
Stephanie Woodard for the record, that's my understanding. We would need a legislative sponsor.
If I'll jump in, I know that the AG is holding some BDRs for the work of this subcommittee, but I think that this might be one that would be outside of that single subject. That, you know, if there is an omnibus or another bill that the AG is bringing forward on based on some of the others, I think this is different enough that it would need its own bill draft request. Of course, you know, you'd have to consult legal at LCB just to make sure. But I do think that that's one of the benefits of having legislators involved in this committee, is that they do have the opportunity to take some of these recommendations and ideally co-sponsor across the aisle and across both houses to come forward and use their bill slots for these recommendations. So I would submit on December 14th to our legislators on the committee that if indeed the SURG group does approve this recommendation, that we will be needing sponsors for this and any other BDR requests that are not included in the AG's proposed BDRs.
Thank you both for that. I appreciate your input. I think this looks good as it is if we keep our original recommendation and then make the suggestion to the prevention subcommittee to add the data sharing agreements between public safety and public health to their recommendation, and keeping these justifications, action steps, and the research links. It probably is best if we look at each of the recommendations as we go. So at this point, unless there's any other discussion or recommendations, is there a motion to keep our recommendation as it is make the recommendation to the prevention subcommittee for this first recommendation.
Stephanie Woodard, so moved.
Do we have a second?
Assemblywoman Tolles, oh, no, I see Gina. Please, it's all yours.
I would second that. Gina?
Okay, so Dr. Woodard made the motion and Gina seconded the motion. So we'll take a vote on this first one. All in favor of keeping this recommendation as it is, making the data sharing agreement recommendation to the prevention subcommittee. All in favor, say aye.
Aye.
Raise your hand. Aye. All opposed? Any abstentions? Okay, so I think we've approved this first recommendation, so we can move on to the next, Crystal.
Okay. So our second recommendation is to revise penalties based on the quantity of fentanyl analogs or other synthetic drugs of high potency that are trafficked. And there was a related email that I forwarded to the group based on the recommendation that we seek input from the Board of Pharmacy, that you have that information as background. So this is our recommendation. The justification, we heard this way back in May, I think, from Christine Payson, one of our members, that we have these weights and the amount of fentanyl that can be lethal. And then you can see underneath that what the prior law, which that includes the law prior to AB 236 of the last legislative session. So at one time, our recommendation language was it said something like amend the NRS to revert back to the old penalties. And we've sort of changed that just to be a little bit cleaner under Assemblywoman Toll's guidance so that it's easier for legislators to take action on and understand our intent. So the justification you see here comes from that May meeting. And you can see this was offered by Christine, the language above. While the intent of the legislation was to address Nevada's growing prison population and the expense of that growth to Nevada taxpayers, it did not consider the public safety threat stemming from increased weights involving deadlier drugs like fentanyl being trafficked in the community and the impact to overdose victims and their families. That's our justification. I'm going to skip ahead and we'll come back to the language. Our action step was a bill draft request. We heard at the October 3rd SURG meeting that the AG's office already intends to submit that BDR. And then in terms of research and links, if we are going to include those, I would ask members to submit those to me. I'm going to go back to the language of the recommendation and open the floor for discussion of this recommendation. We did not have any suggested revisions from other subcommittees or from the SURG.
Crystal, this is Terry Kearns for the record. I know that Christine isn't here with us on the call today, so I would just add a couple of comments to this. I can provide, there is some other states who have done this, so I can provide that as a link if you want for the research. I don't know if there's any model legislation, but I'll look for that as well. And one of the things that I would offer up is that in a fentanyl training session I just was in recently, there's a feel from national law enforcement and the national level. Fentanyl's not going away soon. They unfortunately think that there's going to be an increase in fentanyl in the United States, both in our state and throughout the United States over the next few years, which subsequently would mean likely an increase in our overdose deaths as well. So I think this is something timely too, because fentanyl, like some other drugs, the amount does matter. And this is kind of getting at the trafficking of fentanyl and the number of people that could affect through both overdoses and overdose deaths. And I'll open it up if any of the other committee members have comments.
Go ahead, Dr. Woodard.
Thank you, Stephanie Woodard, for the record. Is the intention of this subcommittee to make the recommendation as is, and then leaving potentially quantities to be included in the legislation, or the recommendation for regulations to be developed? The reason that I'm asking is because we know that some of the analogs that are also being developed may actually have even higher potency at smaller doses. And so my concern is if we are overly specific in potential legislation, we may miss the opportunity to really have flexible statutory language that allows us to update at a regulatory level to modernize more quickly versus having to go into the statute. So just wanted to put that out there, that sometimes specificity in statute is absolutely needed. At other times, it could cause lawmakers and law enforcement to become a bit hamstrung.
I think that's a valid comment that you make, because, you know, obviously we are seeing more and more potent drugs as we move through this. So then we may be revisiting this in 2 or 4 years to change it again. So maybe a recommendation, but not specific amounts. Other thoughts? Assemblywoman Tolles, you dealing with this, what are your thoughts?
Yes, thank you. And I have been one to repeatedly recommend to this group that we keep it general, because I think that number one, that's the purpose of the legislative process, is to hear from all the experts in a hearing in the legislative body to just determine the pros and cons of specific weights or the specific language, letting legal have a say as well into the options that are available. For example, is it best to have a certain regulatory body that can respond more quickly to address certain specific changes, while still giving the prosecutorial skill or tools to our criminal justice system to be able to respond to high rates of trafficking, the deadly impact that they have. So I am very much in the camp and remain in the camp that we keep this broad, and then let the legislative process with the input of experts and legal counsel decide on the best and most appropriate exact language.
So am I hearing that this recommendation is good as it stands, and then just keeping as a justification the information about the weights and the penalties and potential deaths, and then providing, requesting for the bill draft request and providing some research links? I know Christine was looking for also additional research links, so we'll reach out to her and see if we can find those as well.
Sorry to jump in, but one more comment that we also have Senator Sievers-Gansert has a BDR set aside for this as well. And just so it's nice to know that there's backup for avenues to pursue this. Thank you.
Hello, no one is available to take your call.
Okay. Do we want to do like as we did before and take a vote on this recommendation before we move on?
Yeah, first we would need a motion and a second. The motion, I think, would be to keep this recommendation as it is, with the justification that we have and the action step for a bill draft request. And we do have the Attorney General's office and Senator Sievers-Gansert who are looking at this as a BDR. Do I have a motion?
This is Assemblywoman Tolles, so moved.
And a second?
This is Shayla, I'll second.
Thank you. So Assemblywoman Tolles moved for it, and our second is from Shayla Holmes. We'll now take a vote on this recommendation. All in favor, say aye or raise your hand.
Aye.
Aye.
Any opposed? Any abstentions? Okay, it's so noted that of the committee members that are on the phone, all are in favor of keeping this recommendation. We'll move on to the next one.
Okay, so this is our third of 4 recommendations. Leverage existing programs and funding to develop outreach response providers and/or personnel that can respond to any suspected overdose and offer follow-up support, referrals, and services to the individual and loved ones following an overdose. Providers and/or personnel to be deployed to anyone being released from an institutional setting who is being discharged post-overdose or suspected overdose. There was a suggestion from the October 3rd SURG meeting to add long-term support for families, those raising their grandchildren, and those going back to school who are predisposed to use given what's happened in their family. There was a suggestion from the prevention subcommittee that we might want to consolidate it with the treatment and recovery recommendation. So treatment and recovery's recommendation is to implement follow-ups and referrals to support and care, linkage of care for justice-involved individuals, including individuals leaving the justice system and pregnant or birthing persons with opioid use disorder. And the subcommittee, the treatment and recovery committee decided to retain that recommendation and revise it as above in bold. So that recommendation will be put forward for the larger SURG in December. I will say that the treatment and recovery committee met earlier this week and is going to have to meet again before the December meeting. So there could be additional changes, but this is one of the recommendations they had a pretty thorough discussion of. So may not change. Another note that you don't see on the slide there is that there was also a recommendation from October 3rd to include individuals with lived experience somewhere in our recommendation, so somewhere in this recommendation 3. However, the treatment and recovery committee decided they want to maintain their recommendation about engaging individuals with lived experience as a separate recommendation to give it the weight that it deserves, that it should be throughout all of the work, kind of almost as the guiding, almost like a guiding principle, but they're not using that language. So in summary, on this slide, we have our recommendation about mobilizing responders after an overdose. Treatment and recovery has a recommendation about linkage to care after institutional, after leaving institutional settings, and they are prioritizing in theirs people leaving the justice system, people in the justice system, leaving the justice system, and pregnant or birthing persons. While your recommendation seems to focus more on the incident of overdose. So I just wanted to point out those differences. I'm going to keep going to go through our action steps. The justification is that there is a body of literature on this. There's research and pilot programs in Arizona, Texas, and Missouri. The action step is an expenditure of opioid settlement funds, and we do have some research links provided by our member, Shayla Holmes. So we'll come back to those in case there's anything you would want to add to that. For now, I'm going to go back up to the recommendation. And if I can further explain anything, I know that's a little bit confusing with all of the evolution of the different recommendations. Please let me know.
Crystal, Terry Kearns for the record. My first comment on this is that we make the recommendation to treatment and recovery on theirs, their recommendation about implement follow-up and referrals to support and care, that they should change that, the last 3 words in that to people with substance use disorder and not just opioid use disorder. So I think it needs to be comprehensive of all substances, not just opioids. Because we do know that based on presentations we've had from HIDA that stimulants, specifically meth, are a problem within our state. So that's my first comment. My second comment is on the suggestion from the 10-3 SURG meeting to add long-term support for families. Well, I think that's very important. I think that part of the reasoning behind our recommendation is to follow up with people and those living with them who have experienced an overdose that are leaving institutional settings. It's really to get wraparound services for them and not provide them specifically. So I think that the long-term support, well, families would be included in our recommendation just for that initial follow-up, but then trying to get them into long-term support for the families. So those are my 2 comments on these recommendations. I'd love to hear from the rest of the committee members.
I see Gina has her hand raised.
Thank you, Gina Flores O'Toole, for the record. I have a lot of concerns about the suggestion from the 10-3 SURG meeting. If we're leveraging our existing programs, it's a stretch already to leverage our existing programs to provide the immediate need once an overdose occurs. I think that supplying the long-term treatment might be a totally different idea and a response. So that would be my recommendation, would be to leave it as is, to leave our recommendation as is. Although I would always love to include people leaving the justice system based on my treatment experience. I'll just add that. Thank you.
Dr. Woodard, and then we'll go to Shayla.
Thank you, Stephanie Woodard, for the record. I would agree with Terry Kearns's recommendation to change, to offer the change in language to the treatment and recovery recommendation to be more expansive and not limited to opioid use disorder, but all substance use disorder. And I am in favor of retaining the language that we have in our recommendation. I don't know if it's important for intent to clarify that institutional setting includes settings of incarceration. Sometimes it can be interpreted as a hospital or a residential treatment facility. So I think just for clarity of intent, we may want to be clear that what we are indicating by institutional setting also includes settings of incarceration.
Crystal, I was just thinking after institutional setting, you might, and I don't know what the committee feels, put in parentheses and say examples, hospitals and settings, incarceration settings or facilities are 2 examples. It's not an extensive list, but those would be 2 examples.
I was trying, incarceration didn't feel right. So I was like, is it carceral facilities? I don't know if I made that up. I want to make it consistent. I'm just trying to think of what that is. It's not hot. If it's hospitals, it's also a place. So, and make sure that it's like, and others.
Yes, because people could overdose, for example, in a public place and not go to a hospital. And if we have information of that, we may be doing outreach as well to those individuals that have not been in a hospital or a criminal justice setting.
And if anybody wants to send me other wordsmithing, I think that would be okay to use the chat because I will then make it visible to everybody. So I know we are not using the chat for public comment, but if you do send me something, I will make sure, this is for members only. I just want to make sure that as I'm editing, I'm not messing with things too much. So if you have an edit, please send that to me. Shayla, go ahead.
I am in agreement with all the conversation thus far, and I agree with Gina in that not wanting to add long-term support within this outreach response, but that long-term support would be one of those referrals and follow-up pieces. So, yep, nope, I am in agreement with everybody at this point in time and the recommendations for the change and addition with the examples.
Crystal, I don't know if you want to put it on here, but in that last recommendation for the treatment and recovery, if you just want to put the recommendation about substance use disorder instead of opioid use disorder. Or you may have it noted somewhere else.
I do have it noted, but I think it's good for us to all see that. So I was trying to do a strike through, but I'm just gonna figure that out.
Okay.
Okay, so pretend we've struck through opioid use disorder.
I see Dr. Woodard made the comment about we may want to add community settings in addition to institutional settings.
Thank you, Dr. Woodard. Thank you, Dr. Kearns.
Do we have any other discussion?
Like,
okay, at this point, I would look for someone to make a motion that we keep our original recommendation with the edits that we made, that we make a recommendation to the treatment and recovery subcommittee to add substance
Chair
use.
Kearns.
Oh,
Sorry,
go ahead.
I know you're setting it up for a vote, but I see that Dr. Woodard has her hand raised. So I just want to make sure we get that comment in before we summarize and vote.
Absolutely.
So Stephanie Woodard, for the record, I apologize for interrupting the process, but I was hoping that we could go back to the slide just before this because I would like to make a recommendation. Oh, maybe it's the one even before this. No, it has to do with additional information as it relates to the recommendation. Sorry, Crystal. It's in relation to funding, if that's helpful. Yeah, so the action step, expenditure of opioid settlement funds. I'd like to make a recommendation that we're a bit more expansive. As Dr. Kearns had noted, overdose is not just from opioids, but it's from other substances as well. And my concern is that if we are overly limited with just the expenditure of opioid settlement funds, those dollars really are specific to opioids. And they're not the ones that are actually funding a lot of these activities that are already existing. And the recommendation is to continue to fund those. And we want to make sure that we're not supplanting funds. So to be more broad. And so I would recommend that the action step be through state funding as well as federal funding. That will allow us to actually be more inclusive and have a lot more latitude when it comes to the development of these overdose response teams.
That's an excellent catch. Thank you for that recommendation. If there's no other discussion or comments, I would look for a motion that we, Crystal, can you go back just one, that we retain our recommendation with the suggested edits that you see to include community settings and hospitals, carceral facilities and other institutional settings, that we make the recommendation to the treatment and recovery subcommittee to add substance use disorder as opposed to just opioid use disorder, and that we not add the long-term support for families that was suggested in the 10-3 SURG committee to this specific recommendation.
This is Shayla. I would make the motion that we make this recommendation as edited on the screen.
Thank you, Shayla. Do we have a second?
Stephanie Woodard, for the record, I'll second.
So we have the motion by Shayla Holmes and the second by Dr. Stephanie Woodard. We'll move to a vote on this recommendation. All in favor, say aye or raise your hand.
Aye.
Aye. Any opposed? And any abstentions? Hearing none, this recommendation will move forward as per the vote of the committee members on this call today. We can move on to the next.
Something that I wanted to add, and I know I should have said this at the beginning, but the way that we're considering the final report that you'll see in January is that recommendations are coming from the larger SURG. And so we are not, this is how it was presented on October 3rd, as if we were going to have, here's the prevention subcommittee's recommendations, here's the treatment and recovery, and here's response. We actually are going to try and create categories of the recommendations so that they really are coming from the committee as a whole. I just wanted to make that note so that you can kind of have in your mind, they will be recategorized and kind of, they won't be revised, but they might be bundled together. So maybe there's one on continuum of care and immediate response, and our recommendation that we just went over is in that category, as well as the treatment and recovery's recommendation about continuum of care in justice system settings. So I just wanted to make that note so you can kind of get in your mind how that will play out. I think it also helps for the discussion at the next SURG meeting, so you can understand that those things will be not combined, but included together. So
this is Terry, for a quick question for clarification, would that then go along kind of with the strategies that we saw in the needs assessment and will likely be seeing in the state plan soon? Is that kind of the idea, to group them under those specific headings?
I don't know that we've finalized the headings, but I do think there is some crossover. So that's a good point that we should look at that when we are making those headings. The ones that I saw in the template that was recently shared internally are workforce development. So I think that's one that's related. So I think as much crossover as we can get. There's another one on data collection. So I think we haven't thought through all of the possible categories, but good note to look at the ACORN, the needs assessment report. Okay, sorry for that break in our flow of recommendations. Number 4 is fund personnel and resources to investigate and prosecute drug-related crimes, including an independent medical examiner for reports that specify the cause of death in overdose cases where the source of the drug supply can be identified and can be prosecuted. That's our recommendation. Keep going, sorry, I'm on 2 screens. We have a justification that by arresting the source of supply, dealers and traffickers who bring this into our communities are removed from the streets. The district attorneys want causation experts to provide the reports before they will go forward with prosecution, particularly in cases where there are polydrugs in the victim system. Both of those justifications came from our member, Christine Payson. There's 2 action steps, a bill draft request and an expenditure of settlement funds. And we have a research link to the CDC. There was discussion in some of our prior meetings about how can we meet the need across the state to ensure rural counties benefit from having a medical examiner, and the resolution or the response to that was that there would probably be 1 or possibly more that could be needed across the state.
I just wanted to bring that forward again in case that question came up for others. So that's our recommendation as well as the action steps, and I'll open it up for discussion. I think Assemblywoman Toles, you might have had your hand raised first.
Thank you. And if I recall correctly, there was some concern about this recommendation, and in light of other discussions that we've had about resolving the conflicts between the Good Samaritan law, Drug Overdose Act rather, and then the drug-induced homicide law, the concern is that I think, if I heard it correctly, the way this is written could inadvertently capture a family in the investigation process. How we define source of drug supply might not capture a trafficker as we've been discussing it, but might inadvertently capture that family member, partner, close friend who may also be using, but not considered as what we would, categorize as a drug trafficker. And that I don't have a recommendation for specific language, but I want to recall that those were the concerns, and I want to address those. And I'm looking forward to hearing other committee members of how we can maybe change this language so that we don't run into actually exacerbating that very same conflict that we're trying to hopefully resolve eventually between Good Samaritan and overdose homicide.
This is Terry Kearns for the record. I think that's a good thought that we need to consider on this. My question too on this was fund personnel and resources. It includes that independent medical examiner, but when we say personnel and resources, are we talking law enforcement? Are we talking about the formation of these like overdose reduction teams such as currently exist in Clark County? I didn't know exactly what the intent behind the fund personnel and resources other than the medical examiner included. And in conversations with Christine, from what my understanding was, when they say the source of the drug supply is that there haven't been family members that have been prosecuted. That's not the intent of this, but I think some specific wordsmithing may be needed, such as a trafficker, because one comment I always got is somebody who supplied the drug that the person overdosed with may be a friend or family member, but I get the argument that that can sometimes be a trafficker too. So I don't know if we want to call out the trafficking source, or I don't know if that's good enough to the intent that we're ensuring we're not capturing those that have supplied something, and often unknowing that it maybe contained fentanyl. They may have thought they were giving one thing and it did contain fentanyl and they didn't know. So those are all valid comments.
Go ahead, Dr. Woodard.
Thank you. Stephanie Woodard for the record. Just to add on, this issue was brought up in one of our last meetings. And I believe Lisa Lee was expressing some concerns specifically. And in that meeting, Christine Payson did really clarify that the goal was to target individuals that were identified as being part of the drug trafficking, and not for friends and family members and others who had circumstance that was related to the overdose. So I don't have a solution for a recommended language, but I do think that we need to be very intentional about the language that we choose, so that we can be clear in what our intent is, and to not have this run the risk of overinterpretation as an endorsement that we would be advocating for a much broader application of a potential law.
Shayla, do you want to add in here?
I'm just listening to the conversation. I'm wondering if some language as far as where the source of the drug supply has been identified through a sale, trying to differentiate between social use or did I purchase this from someone? And if you're purchasing it from a friend and using with a friend, I think that individual is still who we would be looking to prosecute as far as somebody who is selling opioids with potential fentanyl versus individuals who have social connection who are just using together. I think, just listening to the conversation, it seems to be the delineation between not arresting social use friends or family versus who we're targeting.
Dr. Woodard?
Thank you, Stephanie Woodard, for the record. I'd like to make a recommendation that we receive some consultation from subject matter experts on the most appropriate language. I think that language matters, and we run the risk potentially of creating some unintended consequences by changing the language. Just knowing what we are clear on related to intent. Because at this point, I would be very hesitant to be able to move forward this recommendation without some subject matter expert consultation and language change.
I saw some heads nodding. I don't know, is that subject matter expertise? Maybe we can go back to Christine. I believe this is her recommendation and see what she would offer. Oh, Dr. Woodard, I see your hand raised.
Yeah, Stephanie Woodard, for the record. I would also advocate for consulting with Board of Pharmacy as well, because they have had similar challenges. So I don't think it's just law enforcement specific, but there have been some issues noted as it relates to insufficient resources to investigate and prosecute drugs of diversion from pharmacies as well.
This is Terry Kearns. I wonder if also beyond Christine and the Board of Pharmacy, perhaps some of the DAs that prosecute these types of cases to see if they have any suggested language.
I can certainly contact Christine and I can contact the Board of Pharmacy. Is there someone that can get in touch with DAs to run this by them?
Yeah, we can have Christine do that, or I can also reach out to them. That would be fine. I have a process question for Rosalie. Rosalie, if we're tabling this and looking for more information, what's our step forward? Would we have to have another meeting to address this, or how would we move forward with this recommendation?
So before you can make it an official recommendation, yes, you would have to have action at a meeting to make it the official recommendation. There's no problem in tabling at this point, but it would require another meeting to then later finalize.
Thank you for that. I appreciate the guidance. So at this point, it sounds like we're going to table this one, looking for some more clarification from subject matter experts.
Chair Kearns, if I may.
Yes, yes.
If I can offer another option for us, because I do think there's consensus around funding resources for an independent medical examiner. Where I hear the concern is when we tip over into prosecution. And I would argue that it's not the independent medical examiner that's doing the prosecution anyway. It's the independent medical examiner that's doing the investigation. And that we have other recommendations for other avenues to pursue the prosecutorial tools that are available. So perhaps the best way to still hold on to this recommendation, but allow for more discussion with subject matter experts at the table is to take the prosecution language out. And then this subcommittee could decide to pick that up in future recommendations of what do you do with the outcomes of that investigation, or utilize what we currently have in statute for prosecutorial purposes. So really what this committee is identified as a gap in the needs assessment is that we don't have an independent medical examiner to help with investigations, and that's still a valid recommendation in this round for this report. And prosecution can be dealt with separately. And I totally agree that there needs to definitely be subject matter expertise on the language on that. Because I too have some hesitation about, well, what about this scenario? What about that scenario? And that is a much longer conversation. But what we all agree upon is that an independent medical examiner to investigate is a gap right now, and that information would be helpful for a number of reasons, for prevention, treatment, intervention, as well as prosecution. So I would recommend that we change it to fund personnel and resources to investigate, including an independent medical examiner for reports that specify the cause of death in overdose cases. Period.
That's a good recommendation, I think. Let's look at the justification and the action steps and see if they still align with that recommendation. I think they do.
Sorry, before we move on, I do think I left something out. I think source as a, so the cause, but, and I'll leave that to the group to decide. But when we say source, do we mean a person, or do we mean what do we mean by source? So sorry to confuse that a little bit, but that may or may not still want to be in there.
Dr. Woodard, do you want to respond to that or something else?
Yeah, so, well, I do have another one, but it's for the next slide. Stephanie Woodard for the record. I wonder if the terminology as it relates to source is really relevant in this case, or if the language that we already have, fund personnel and resources, including an independent medical examiner for reports that specify the cause of death in overdose cases, is sufficient. To me, I think that meets the intent. Any additional language may be confusing and get us away from what the original intent was.
Chair, if I could just add a clarifying question. I believe I kept to investigate in there, but do we want to keep to investigate in there? So fund personnel and resources to investigate. Or I don't know if that's bad grammar, fund personnel and resources, including an independent medical examiner to investigate for reports that specify the cause of death in overdose cases, or maybe it's just not necessary.
I had the same question because I know I missed it. I think what we lose in the end of that sentence is investigate drug-related crimes. So it sounds like we would not want to bring that back in there. And then investigate is it is hard to find where to put it if we don't add that. It's how I'm struggling to edit here on the fly, but. Does anybody have a suggestion? Dr. Woodard?
Stephanie Woodard for the record. Are we intending for this recommendation to be more broad than an independent medical examiner? Because if not, we could lose the word including. and just to make it fund personnel and resources for independent medical examiners.
Jerry Kearns, for the record, that was my original question on the personnel and resources to investigate. But I believe that that was Christine's original intent, to fund more investigative positions, perhaps at the ME, the medical examiner and coroner's office, and also for these overdose reduction teams. That's what they call it in Clark County. If we wanted more of those, I think she originally intended funding for law enforcement personnel or investigative personnel through the ME or coroner's office.
Given the discussion, I'm not sure I've captured everything that you want to see or not see in this recommendation. So if someone doesn't mind kind of reading back what they think the proposed recommendation on the table is, I can capture that.
Crystal, it's my opinion, it's two separate issues. The issue of the independent medical examiner, which from, if I remember, Christine said is a pretty costly report that is provided. And I know we had discussion about having an independent medical examiner that would support the overdose death cases throughout the state. But then there's the other issue of the funding for the investigative personnel and resources to investigate the cases. So I don't know if we come to conclusion with keeping the fund personnel and resources or funding an independent medical examiner for the reports. And then the second part is the investigative personnel. Thoughts from the committee members?
Gina Flores O'Toole for the record. I like the fund an independent medical examiner for reports, leaving out the investigative part.
Thank you, Gina. So I just was splitting those up, but I do hear what you're saying, Gina, is you would rather go with this second one, fund an independent medical examiner for reports that specify the cause of death in overdose cases.
Crystal, I think Dr. Woodard put some language in the chat, fund personnel and resources for independent medical examiner, parentheses, examiners for investigations and reports to specify the cause of death in overdose cases.
Stephanie Woodard for the record. The reason that I added investigations is because I believe that the reports are specifically for those investigations. So we don't lose the investigations terminology, but we properly place it under the oversight of the medical examiners, because that is their intent and purpose in this case, I believe.
Those holes. Me, Chair.
Assemblywoman Tolles, did I hear you say something?
Yes, I think that Dr. Woodard's language captures it well. I wouldn't feel right about moving forward by taking investigation out completely, particularly because our recommending member is not on the call. So I would recommend that we keep that language in there, but simplify the overall statement. I think Dr. Woodard's summary hits the mark, where I would feel comfortable voting to support this. Otherwise, if we were to change it and remove investigation altogether, I would recommend that we come back together at a time when Christine Payson, who recommended this, could join for the discussion.
Thank you, Dr. Woodard. Sorry, Chair Kearns.
That's okay, go ahead.
Stephanie Woodard for the record. Prior to us potentially moving towards a motion, I would like to just review the additional contextual information that we would be putting forward along with this recommendation. because I did have a suggested edit. So for the expenditure of settlement funds, again, I feel like that is incredibly limited and does not allow for the full contemplation of potential funds that could go towards this effort. So I would like to change that language. Certainly we could include expenditure of settlement funds as an example, but I do believe it would be local, state, and federal funds, or local, state, and federal funds, including opioid settlement funds. Because again, local jurisdictions are also getting settlement dollars. And if this rose to a level of priority that they wanted to fund it independently, they could certainly do that. So the broader the opportunity here, I think the better.
I agree with that. Plus, in the justification, it talks about the district attorneys wanting the causation experts, particularly in cases that are polydrugs in the victim system. So in that, it goes beyond the opioids.
I'll go back to the recommendation. Chair Kearns, you've been doing such a great job with summarizing the conversation and then calling for a vote, which is where I think we're at with this one.
Just a thought from the committee. Do you feel like this new recommendation we have, fund personnel and resources for the independent medical examiner or for investigation and reports to specify the cause of death in overdose cases? Are we good with moving forward with that, or do we want to table this until we get more input from our subject matter expert, Christine?
I think we're good with that. If you'd like a motion, I would so move.
Thank you. We have Gina putting a motion forward to accept the recommendation that we changed. Do we have a second?
This is Shayla Holmes. I'd second the motion for the edits.
Thank you. So we have a motion from Gina and a second from Shayla. All members in favor, say aye or raise your hand.
Aye.
Aye.
Any opposed? Any abstentions? So we have unanimous support of all the members on the call. We can now move on to the next recommendation.
Okay, actually that concludes our recommendations. The other items we have are for further review. So the intention would be that each subcommittee has an option to kind of tee up what they're going to be working on in the next session of our meeting. So for further review for this committee, there's the resolve the conflict between the Good Samaritan Drug Overdose Act and drug-induced homicide law. Immediate actions may include recommending community level education using best practice guidelines, as well as education for law enforcement personnel. And then the second one is a policy change to cover non-pharmacological or complementary treatments for pain, also to increase coverage for preventative and non-pharmacological modalities. And then we are noting our support for reform and fund criminal justice services to offer all 3 FDA approved medications for the treatment of opioid users. Not sure we want to say it that way. Probably treatment for people who use opioids. I don't know if that's the right language. Okay. And that one, there is a BDR coming from the Interim Health Committee, as I understand. So I was trying to find that bill draft number, but I could not. So if anybody has it, we would include it in the report. With that, I would just open up for discussion if anybody wants to see revisions to these for further review recommendations. And then we still do need to circle back to our guiding principle for those that can stay on. Do you have your hand raised?
Stephanie Woodard for the record. Crystal, I will get you the BDR language that was work sessioned out of the Interim Health and Human Services Committee for inclusion here.
Thank you.
Crystal, were we scheduled till 10:30 or 11? Crystal,
Dr.
this is,
Woodard and, oh, go ahead.
I was
sorry.
just gonna say, were we scheduled till 10:30 or 11 today?
Oh, I'm sorry, 10:30.
Okay, thank you.
I saw Assemblywoman Tolles and Dr. Woodard both come off mute, so I don't know who wants to go. Oh, okay, Assemblywoman Tolles is, and so is Dr. Woodard. Then I don't know if there's further discussion on these. So Chair Kearns, I would leave it to you to see if we are ready to, I don't know that these need to be voted on, but they would be included going forward to the larger surge.
To me, the only one that would be in action is to support the reform and fund criminal justice services to offer all 3 FDA-approved medications. The other 2, we have already agreed that we're going to review and do a deeper dive into them in future meetings. So do we have support from all of the committee members to reform, for the support to reform and fund criminal justice services to offer all 3 FDA-approved medications for treatment of opioid use disorder? Or a motion to include that?
This is Shayla. I'd make a motion to include the reform for and fund criminal justice services to offer all 3 FDA-approved medications for the treatment of opioid use disorder.
This is Assemblywoman Tolles. I can second that.
So we will include the notes for support for that in our recommendations.
Okay.
And then my question would be to the group about that overarching principle, the inclusion of that or the revision of that.
So considering the recommendations that we've revised and will be putting forward, is there still a version of the guiding principle you'd like to suggest? Another option would be to see if the larger surge wants to have an overarching guiding principle, and we could submit this for their consideration, or we could submit, do other committees want to have a guiding principle, although that might require them to meet again. So that does make it a challenge.
Yeah,
so
as I mentioned, I listened into all of the other subcommittees, and they noted that we had a guiding principle, but none of them suggested having a guiding principle, overarching guiding principle for their recommendations. So it may be a case of, and I do like the kind of harmonized criminal justice and public safety response or public health responses. It looks like Dr. Woodard had a comment.
I think it is the BDR. So we'll change our suggested language or our note support for that we saw in that last slide. I'm going to cut and paste this out of the chat. And Rosalie, stop me if I know we're using chat and we're not really supposed to. So I don't know if I need to read the entire chat. I could also put it on a slide. I'll put it on a slide for sure. While we continue, oh, sorry, go ahead, Rosalie.
I can just, Rosalie Bordelove for the record, I can see the slides should be sufficient. I just want to make anything in the chat just has to be recorded and made part of the record of the meeting. So to the extent you can copy and paste it out later, but that's usually why I caution against it.
Okay, thank you. So Maddie will need to have the chat record, which you'll get when I send you the recording, included in the notes.
Sounds good.
So that was just on our note support for, but I want to leave this slide up on the proposed guiding principle so we can close out that discussion if this is something that you'd like to go forward with, revise, or take up another option.
I was just going to say, this is Terry Kearns for the record. So my overarching thought is we have harmonized criminal justice and public health response, but I almost feel like it's beyond criminal justice. So is it public safety response, public safety and public health response? Because we often look at our EMS and fire response, law enforcement response. Are we also at some point going to include, you know, our specialty courts in this, and outreach that we would be doing to people coming from the specialty court? So I feel like it's bigger than just criminal justice and should be public safety at large.
I see head nodding, and Dr. Woodard, and then Shayla.
Stephanie Woodard for the record, I agree. I see Shayla's hand is up. I was gonna see if you would entertain a motion, but I'll let Shayla make her comment.
I just wanted to perhaps offer public and behavioral health responses, as typically when we see public health, we think medical, but perhaps I'm the only one whose brain is trained to think that way, but we typically separate out public and behavioral health, and I think it's both.
Assemblywoman Toles.
I would just add that it's not to all things, but to specific to substance use. So harmonize public safety and public and behavioral health responses to substance use in our communities and state.
Yeah, I think those are good edits, and actually may even go beyond our committee. So I don't know if it's a case we want to keep this for our subcommittee, suggest this be an overarching guiding principle for the SURG. Thoughts from the committee on that? Doesn't sound like we have any discussion. So would we entertain a motion to include the edited proposed guiding principle for the SURG response subcommittee?
Jill Toles, Assemblywoman Jill Toles for the record, I'll make that motion.
Do we have a second?
Stephanie Woodard, I'll second.
So Jill Toles made the motion, Dr. Woodard seconded the motion. All in favor of moving the edited guiding principle forward as the response subcommittee's overarching guiding principle, say aye or raise your hand.
Aye.
Any opposed? Any abstaining? So we'll move forward with the edited addition of the guiding principle for our overarching guiding principle. The last agenda item before our second public comment that I just want to bring to everyone's attention is that according to the SURG guide bylaws, our subcommittee basically will serve all the members will serve on the subcommittee for 1 year, and after 1 year, the working group chair, which is Attorney General Ford, will determine if the subcommittee needs to continue for another year. If the committee is needed for another year, the working group chair, again, AG Ford, will appoint the subcommittee chair and members from the working group. So having said that, we'll be coming up on our year, the beginning of next year. So I just want to put out to the members, if you want to stay on this subcommittee, please let us know your intentions. Or if you feel like you want to be on the prevention or the treatment and recovery subcommittee, please let us know that. And then, as much as it pains me to say this, I know that we're going to be losing Assemblywoman Tolles as part of our group. So we would need someone for chair and sub-chair. I've been serving as the chair. I'm happy to continue to do that. But under the very sage advice of Assemblywoman Tolles, that each subcommittee should have a chair and a co-chair. So I would look to see if anyone would be interested in being the co-chair.
Dr. Kearns, this is Shayla Holmes. I would be willing to serve as co-chair.
Thank you. I appreciate that. And as I said, I don't think everyone needs to state their intention on being on this subcommittee or being on another one. We just let staff know. So if you could let Crystal know your intentions so we can provide that information to AG Ford so he can make his decision on the appointments. And we'll note that Shayla has graciously offered to be the subcommittee co-chair. At this point, we'll open it up to public comment again. And as before, a public comment will be via the Zoom meeting. Public comment shall be limited to 3 minutes per person. No action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241.020. Crystal, do we have any public comment?
People can indicate their wish to give public comment by raising their hand or coming off of mute. I'm going to pause and see if anybody would like to do so. If you are unable to come off of mute, which could be the case because I muted people during our call if we could hear background noise, please let me know in the chat, or you can still hopefully use the raise your hand function.
Crystal, we'll give it a minute to see if anyone has public comment. I want to personally thank all of the committee members and our legal counsel for all of your hard work. This has been, really getting into the weeds and providing these very significant and well thought out recommendations. I'm very proud of the work that our subcommittee has done. So thank you all.
I don't see anybody wishing to give public comment. Oh, sorry, someone told.
And lastly, I would like to thank Assemblywoman Tolles for her guidance and leadership throughout this process. She's been, a steadfast supporter and great example for us.
Thank you all. Thanks to everyone for all this hard work and for continuing it. And I look forward to continuing to stay engaged behind the scenes and cheer you across the finish line. So thank you.
So at this point, if there's no public comment, our meeting will be adjourned. Thank you all.
Thank you.